Afternoon, it's April the 14th, 2022. I am Matthew Holt, the founder and publisher of the healthcare blog at Baltimore on the Twitters. Got another THCB gang for you. We've been off for a couple of weeks while I've been sort of doing some screwing around in the background, but now we're back strong and we actually have our lineups ready, an incredible feed organization for the next several weeks. Today we have Rosemarie Day from Day Health Strategies, Benz, our employer specialist from Siegel Benz, Casey Quinlan from the always hilarious and provocative Healthcare is Hilarious podcast. And then our double trouble futurist, Ian Morrison and Jeff Goldsmith. So, hi gang. Great to have you all back. Looking forward to the chat and the conversation. And let's just dive in. Who has seen what that they think have been working on that they've who has seen what? What have you been working on and what's been interesting to you in the last couple of weeks? And I will start with you, Casey, as you waved.
Yeah, well, I got to say, I have long witnessed the John Oliver effect and various things because he always covers something, a major topic for the most of the segment of his like half-hour-ish HBO show on Sunday night, last week tonight. This week, he did data brokers. Now, I've been yelling about data brokers for a very long time now. And, you know, the Light Collective caught up with me and I caught up with them and you know, yeah, so we're still making noise. But one does feel sometimes like one's shouting down a well. But then when John Oliver hops on and talks about what's been important to you for the last 4 years, all of a sudden it's like, OMG, I didn't know I had that many people who would tag me about this. But yeah, that's been a lot. And then simultaneous with that, speaking of conferences, which we were before you guys joined us, all of you out there in YouTube land, but there's a new platform coming called Sovereignty Network. So stay tuned. I will explain if asked.
Okay, well, we'll look forward to the data broker thing because that's the big deal. And I think we don't have Devon on this week. It would be great to have her, but we can make comments about that. And then in a future episode, she can come back and tell us what's really going to happen. Anyway, Rosemarie.
Oh, I think, you know, it's are we really done with coronavirus? It's interesting that the federal government just extended the so-called public health emergency for another 3 months, 90 days. And so that has a lot of implications. So that means it'll go now until July 15th. And that means there'll be continuous Medicaid coverage, things like that states have enacted during this time. And so that's good news if you're on the side of the aisle that likes to not kick people off of healthcare coverage.
Yeah, well, and we'll come back to that one, because I think that we have to start, at some point with this crowd, to start thinking about what happens to the future of Medicaid expansion, non-expansion, what happens to the temporary measures that were in for subsidies for the Obamacare, the exchanges. All right, Jeff.
Well, in the Schadenfreude Alert Department, triple Pulitzer Prize winning investigative reporter Walt Bogdanich for the New York Times had on the front page of the Times this morning a devastating piece on McKinsey and its conflict of interest problems, which don't seem to be going away. This one was about the $200 million plus a year pharmaceutical practice that was going on in parallel with a huge FDA consulting effort staffed by many of the same people. And you kind of wonder how many more of these it's going to take before McKinsey's remarkable reputation is pretty much no more.
It's been a while, though. It's been a decade of that stuff. So we'll talk. All right.
I think it's been more than a decade.
Well, I mean, it's been a long time, but the revelations about South Africa and Purdue and, now this,
the Purdue settlement cost them $600 million. That was their, liability insurance payoff. But this, this is frankly deeper and more concerning than being involved in, how do we push this drug? They were, Alex Azar's policy chief was the former head of McKinsey's healthcare practice, Paul Mango, who's a good guy. I've just got a book out on taking a victory lap on the Project
Warp
Warp
Speed.
Speed,
Yeah.
which, you know, saved a lot of lives. But, you know, it's, you know, if you're in the consulting business, you're kind of like, oh my God, you know, you know, if you're in the policy world, you're like, how on earth could people miss this?
I love that. Talking about consultants, Jen.
I don't want to be in
I'm
that.
I'm not saying the $600
in that
million
same
fine is
category.
coming to your way.
No, thank you. Well, on a much lighter topic, I've been at conferences in real person in life the last 2 weeks, and it's been really, really fun and energizing, and also exhausting to be around so many people. But I was in Las Vegas for the HR Executive Health and Benefits Leadership Conference, which was about 1,000 people from all different aspects of the benefits world, employers, vendors, consultants, kind of you name it. And then this week I was in Albuquerque for the Council on Employee Benefits Conference, which was a really cozy event. There are about 100 people there, primarily benefits leaders at large employers, and then just a handful of us consultants who get to attend and join along because we're members as well. And it was very fun, tons of great conversations. And so far, I don't think it was either one where it was a super spreader event. So that's really great.
We'll see about that. I met Ian at a conference the other day, and I don't think I infected him. Well, it's not with COVID.
No.
Ian.
No, I was lovely to see you in person, Matthew. Yes, and indeed, like Jen, starting to go to things in person. I'd be really curious, Jen, to hear about the content, your content take from those. Partly what I've been working on this week, I agreed to give a talk non-healthcare about the business world after COVID, which I'm struggling to pull together. So one of the things I've been digging into is whether there is indeed actually a great retirement or resignation, or and I'm sort of perusing the works of the great economists, including Kim Kardashian, who waved in and said, you know, with some expletives, that people are just too bloody lazy and they don't like to work. I'm actually quite persuaded the other way, that I think Paul Krugman had a piece not long ago, and also I've been following the work of Derek Thompson at The Atlantic, who I think is very thoughtful about sort of changes in the zeitgeist. But anyway, I think Thompson's characterization of it's the great switcheroo. I think it's people upgrading their work in large measure. I mean, there is a resignation factor and retirement, and Jeff and I have talked about that in the healthcare context, and that's a real deal. But I think you look at the labor statistics, that a lot of this is just people going, you know what, I can go and move and upgrade my life. And I think you couple that to the return to work policies, and I defer to Jen on this. I mean, I just had drinks with a friend of mine last night who works for an unknown, very large technology company that rhymes with Snapple. And there's a high probability that half of the people quit if they're forced to go back to the millennial loop or whatever the thing's called. So anyway, that's why. So I think a lot of turmoil still in the labor force, a lot of people taking an opportunity to upshift. And I think Kim Kardashian's Nobel laureate prospects are severely diminished.
I agree with Kim Kardashian. I'm extremely lazy. I wish I didn't have to work. But
You know, there was
I agree with all of that.
and there was a piece a day or two ago in Bloomberg about the great unretirement, about how a lot of baby boomers are going right back into the labor force, and maybe they're per your thesis going into different.
Guilty as charged. I never left. You know.
Yeah.
I mean, look, and I hate to be ageist about it, but there are three of you who are beyond Social Security.
Yes.
I don't know
Guilty as
about
charged.
on this call, who are all not on this call, not that this counts as work. This is just fun, but you know, who are all of you are still with you. And I think there's two things. One is, right, as Ian said, you know, where are people doing it? And I was on a call with somebody in Canada today who wants to come work for who was talking about the growth of offshoring to Canada of like labor, and also other types and technology, but also business development and God knows what else, because they still speak the same language and that kind of stuff, and it's the same time zone, and it's still a bit cheaper there. And the other thing is shorting commercial real estate. I mean, I don't know whether should be doing that, but I mean there are still, I don't know, Jen, you have an office still in San Francisco, right? But there's still,
Mhm.
it seems to me that, the company that rhymes with Snapple and the company that rhymes with Google, they're trying to get people to come back, but if you force them, there are plenty of people who just have given up on the office thing. And, there are several hundred, if not 1,000 person companies I know in digital health who have raised all this cash and don't have an office. And I was literally, my wife works for a Boston-based company that until the pandemic had never hired people virtually of any kind. And that when they started the pandemic, there were 300 people all in Boston, and now they have 300 employees in California alone.
Yeah.
And they obviously grew dramatically during that time, raised a ton of money. But, this is it's just a very, very different world. And as Ian says, people aren't figuring it out. And probably it's the old managerial command and control baby boomer types who want to drive everyone back to work. It's people my age.
Yeah,
it's the
difference. Yeah, it's the difference between the demographics of the executives making those decisions and then their workforce. There's just a huge disconnect there in a lot of organizations. But to the earlier points, employees have a lot of power right now, probably more so than in several decades, and a lot of choices. So it's going to be interesting how that plays out. And if you read the articles about people who have been going back into the office, and I've talked to lots of folks about this too. Why are you in the office if you're just going to stare at Zoom all day long? Because all of your colleagues are all over the country. It doesn't make any sense. You don't need to be there.
Well, I can tell you this as a recovering consultant that, consulting over Zoom is really like kissing your sister. You don't have the faintest idea of what's going on in your organization that you're working with. Unless you can go out drinking with the client. Now, maybe you can just go out drinking with the client and not go into the office. That's a possible, but all the really important stuff happens after the meetings.
Yeah.
And
if you
really don't
don't
have
spend
any idea of what's going on in the organization, you can't really be all that helpful to them.
If you don't spend all that money on office space, then you have more of an expense budget to take the clients out.
For the drinking, exactly.
It's going to be back to Wall Street and strip clubs any minute now. I can see it.
Well, the whole
I
strip
didn't say a
club
word
thing
about
never really
strip
appealed
clubs,
to me, but
Matthew, that's
I'm spending too much time listening to Michael Lewis's new podcast, which, by the way, has quite remarkably has the whole story of Athena Health in it, and Todd Park. Doesn't mention Jonathan Bush's name the entire time. I don't know what's going on there.
Really?
What is this? What is this podcast?
Michael Lewis has a podcast series called Against the Rules, and his first one was about referees, the second one was about coaches, and the third one is about experts. And his first one is about the person. It's actually fascinating. I guess it's my update. I listened to this podcast last night while I was running, or should I say, falling. I actually go off over a tit and beat myself up a bit. Those of you on our podcast won't see my flesh wound on my arm, but it's not good. Anyway, but what he was talking about is expertise, and he was talking about, in this case, that when Athena Health got going, they couldn't get their bills paid, and they ended up becoming a company, as many of us know, that ended up doing essentially medical billing and getting bills paid more effectively. And it was a whole story. But essentially what they did was they found this one medical biller in Boston, and Todd and Ed Park especially, the programming brother of the two, sat down with her for 3 years and iterated on everything that she knew about medical billing. All these people knew about it, to get it out of her head into technology, into code. And that's basically what that company was built on. And it's fascinating. But they did manage to have Michael Lewis's entire interview with Todd Park and all these other people that say, without mentioning Jonathan Bush's name, which I thought was, given his outlandish personality and size of his persona in digital health world, was quite surprising. Anyway, can we go back just and dig in a bit to Jeff, to the McKinsey thing? I'd like to hear a bit more about, for those who haven't read the article, what they were up to, and then I'd like to get this point about, we've seen all this sort of scandalous stuff going in many different aspects of American life, including a lot of it in healthcare, and yet nothing ever seems to happen. So what do you think is going to be the impact? So tell us the story and discuss it.
He talked about a congressional hearing that was getting ready to happen, and the fact that they had a chance, both committee staff and Bogdanich and his reporting crew, to review thousands of McKinsey documents, emails, and that sort of thing about how they pitched their expertise in drug development and getting drugs approved and all the rest of it. Essentially arguing, we're in the middle of this agency and we're working with them and we know how they think and we know what to do. I mean, that's basically, and it showed two parallel resumes, paragraph long resumes of the same guy, a senior consultant, McKinsey, a PhD biochemist or something like that with an MBA from Wharton, who was working both sides of the street. And it wasn't clear that the McKinsey engagements at FDA were about drug approval. FDA is an incredibly complicated place. They were doing strategy consulting for McKinsey. They were doing organization development consulting for McKinsey. But the tagline of it's what we know and who we know really resonated, particularly since a deputy secretary of HHS at the time was a former head of their healthcare practice. Now, there were no allegations of direct conflict of interest, but I have a suspicion that those hearings are going to be very painful.
I guess the question is the sort of so what? We've seen certainly in the last decade, but going back further, right? Incredible influence, both the revolving door of people that, think about the SEC going to banks and of staff between agencies.
There really is no industry sector that's in any way regulated.
I don't think this is unique to McKinsey.
Yeah.
But it comes on top of a scandal with their bankruptcy practice, where they were representing firms in bankruptcy without disclosing to the bankruptcy court that they had a huge number of the creditors of the firm as clients. And there was this alleged, wall. There have been 4 or 5 similar arrangements where there have allegedly been walls. In this particular case, kind of a porous wall. And there was an example in this article about how one of the McKinsey partners working with Purdue Pharmaceuticals objected to characterizing the overdose thing as an epidemic. He actually played a role in editing briefing documents for the Secretary of Health and Human Services that were being prepared by McKinsey. That's not good stuff.
So do we collectively, if you go across the board, whether it's finance, health, other, all these different areas, not to mention, we have committees right now investigating whatever the hell happened on January the 6th, 2 years ago, which we still haven't, 2 years ago, a year and a half ago.
Oh, year and a half ago.
Which we, it seems like a long time ago, but, we're apparently, and for that matter, I understand that Javanka got given $2 billion by the Saudi government to go and invest.
No, not the Saudi government, MBS.
Well, is there a difference between the Saudi?
He is the Saudi government.
You're splitting hairs, right? But while obviously that, talk about revolving doors out of the highest, some of the highest offices in the land. I don't see, speaking as the attack dog rabid lefty I am, I don't see any appetite from DOJ or the Biden administration to go after the previous administration for all the stuff that looked absolutely nakedly corrupt. You didn't see any appetite from the Obama administration to go after the Bush administration and Cheney and all that Wolfers, all that gang over some of the stuff that was done during the Iraq War.
Well, that's because everybody's hands are dirty.
The answer is if everyone's dirty,
everybody's playing this game.
You wonder why we have a rising tide of anarchy in our country. If people don't have respect for authority, if they don't believe that the public's business is being done in a forthright and honest way, then the civic culture corrodes. Yeah. And we end up with a society that is really falling apart. So, I don't think it's a question of an individual administration's partisan interests at all. It's, do you really trust the FDA? Do you really trust the CDC? Do you really trust the Department of Health and Human Services to do the public's business? That's the real question.
Yeah.
And it's a question that goes way beyond.
And I mean, this is particularly sad for the folks that are, I'm going to use a phrase that's probably going to get me in trouble, but the worker bees, the people who actually do the work, who actually perform the functions in the departments, various federal departments involved in whatever, they're doing yeoman's work. And they're working really hard, and they've been doing it for a long time. They don't get a lot of thanks. And then they look up and see essentially the ordure emerging from the corner offices. And I have to say, I don't blame them if they start thinking, what's the freaking point? Why am I even bothering? I mean, they still do, but I just, I don't see a lot of reward for them emotionally continuing to do this, and given stuff like McKinsey opened a door in its firewall between pharma clients and regulators. It's like, why am I even bothering?
Right.
Well, but there, I mean, there's been so one thing that comes in. There's been a ton of, this is a sort of the pattern that we've seen forever around DOJ comes in, finds someone, pharma company / hospital / home care thing, the small guys who run the few $1 million frauds go to jail, but the big companies who run the big frauds get fined a few $100 million and back to business as usual.
Ouch,
and this, by the way, spread to healthcare IT when they've got federal dollars, and you had eClinical Works and Practice Fusion and even Athena Health and some others, who were bending the rules and getting hit with qui tam suits. There's even one right now for Kaiser over Medicare RAF risk adjustment upcoding, where it looks like a John Grisham novel, right? Is the guy who blew the whistle? Is he also the guy who put the program in place? We seem to have accepted this for decades, and I'm with Jeff. It's like it's slow corrosion of trust in the whole thing. But the answer seems to be to vote in sort of the Marjorie Taylor Greene type people who want to burn it all down, but don't seem to have.
Marine Le Pen,
Marine Le Pen, who seem to be more corroded by this stuff than every. I don't know. Anyway, Ian.
Well, I just a couple of, and unfortunately, I haven't read the piece yet, but I think it's a very important issue. A couple of comments. One is, I think we kind of accept the revolving door story, which is, even former prime ministers and presidents go and work for the Carlyle Group when they're done, right? And Goldman Sachs basically, will have people in whatever administration, regardless of its color, blue or red. So, we're kind of accepting of that. I think the troubling thing that Jeff's pointing to is the simultaneous action where you've got advising clients on the one hand and regulators on the other with the same people. That seems to me a slightly different order of magnitude of complexity. And I would just tie it back. I know all of us have run our own consulting shops, and many of us have probably had relationships with the big guys in various forms. I know Jeff and I both have been advisors to major firms, but part of this is a corruption of scale, that these guys have an appetite for feeding the beast. I was involved with Accenture in the early creation of that. And part of the reason I stopped working with those guys is not because they aren't terrific, but they were sort of so obsessed with what they called their diamond project, which is to get 100 million in revenue out of each client. It just became sort of like, feeding this enormous machine.
McKinsey recruited me to run their worldwide healthcare practice in the mid or late 1980s. And I met the leadership of the firm. I've, for decades, admired them as probably the premier analytic force in this industry. They do phenomenal work. It's just, I've had a lot of friends that have worked for them, a dozen at least. This is a firm I know pretty well. It has a storied history. It's an elite group of people, and it's just, you bear a special burden. People are shooting at you. You have to be purer than Caesar's wife to do this kind of stuff. And if you don't have executive leadership really setting an example and basically saying, this is what our culture permits us to do, and these are things we cannot do without destroying that culture, well, then you get what's been happening to them over the last years.
I would like to recommend a book if you haven't read Winners Take All by Anand, and I'm not going to be able to say his name properly.
Did you read it or us?
Thank you, Casey. He writes for Time Magazine. He's amazing, and it's really. And he worked for McKinsey as a young buck, and he takes down McKinsey, Clinton Global Initiative, a number of these entities that he just feels like are maintaining the power structure, kind of whatever side of the aisle. It's just really making sure that the elite and the moneyed classes kind of keep on going and get bigger and more powerful, essentially. And that it's in the end, it's a call to action for young folks to not get seduced by that. Go work in government, go do the hard stuff. Don't go consult to government in McKinsey or wherever. And I want to, so and it was an amazing book. My son actually recommended it, that I read it. And it was.
What is it called again, Rosemarie? Winners
Take All. Oh. And it's a great read or listen, however you do your books these days. And
how long ago?
When did it come out?
It's recent. It's within the last year or two, isn't it?
Yeah, within the last few years. He's got a new one coming out called The Persuaders as well.
Yeah.
But it is a call to, I mean, it's a question of ethics and what is really the purpose of all this. And when you said feeding the beast, and that takes on a life of its own. So you can have good people individually that kind of almost get sucked into the system. So he's saying, check yourself, like when you're making these decisions, you young folks going into a career. And it's a in praise of the good parts of government. And I sitting here in my corner of the world in Massachusetts, we've had a lot of Boy Scouts and Girl Scouts running things in government. I've had an amazing career in government. The ethics rules are incredibly strong, tons of sunlight and transparency, still have a strong press that keeps an eye on things. And so, it's not like there's never a problem. Some speakers of the House have had to go to jail, but for the most part in the executive branch, from what I saw, that stuff is not happening. So it's possible.
It's possible. It happens. It happens there. It happened. Sorry.
How about that New York lieutenant governor?
Well, there is that, right? So
yeah, but that's
there are regions where it works across the world, right? Hong Kong, traditionally, Singapore, Finland, places where incredibly low levels of corruption. I mean, the Japanese secret service, civil service, where those people sit there. I actually was at a project at Stanford sponsored by the Japanese Health Ministry, which was the first time ever the vice minister, the head of the civil service in that area, had gone to jail because he took bribes from a nursing home officer. He was my buddy. I went drinking with him, and it was the first time ever that anyone in the Japanese secret service, civil service, got done for corruption. More importantly, they stayed in that job from the age of when they left Tokyo University. The elite people, they stayed there till they were 55 or 60 years old, and they didn't flip over and go to work for industry. There was a relationship, of course, but they kind of laid down the law. And in that society, the civil service is stronger than the parliamentary government, which was more corrupt and what have you. But I don't see that. My underlying point is, I've heard these stories forever. This one seems particularly egregious, but there'll be hearings and what have you. But we had hearings after the crash in 2009, and I didn't see too much. I mean, there was some regulatory change. There was some impact on whether companies went public or private, and there have been impacts from it. But the overall culture of Wall Street is still the same. The overall culture of corporate America seems to be the same. If you go to healthcare, even though we went through COVID, I don't see. I mean, we can argue how much the culture has changed. But my sense is that I don't see any appetite for somebody to come in, with significant regulations, significant changes that are really going to force stuff.
Well, isn't it Gordon Gekko? Greed is good.
Yeah.
I don't think that's the way it works.
No, you're right. I mean,
we've had all of this discussion in the country about, the racial divide and, how we have structural racism and all the rest of it. I don't think race is the most inflammatory division in our country. I think the most inflammatory division, and it's the one that brought us Donald Trump, was the division between people with MBAs from Wharton and PhDs from Harvard, and the guy who dropped out of high school and that is, struggling to pay his or her bills. And
who just got a high school diploma and then entered the workforce and has been struggling ever since.
Right.
And people are telling him it's because you didn't go to college, which
Well,
I think is a bunch of BS, but there you go.
Well,
Speaking
but I
as a
mean,
college
the point is there is a tremendous class resentment of people with advanced degrees that run our country and that look down on folks that dropped out of high school or that had a year or two of college or whatever it is. And there was a great article this morning in the Financial Times about who's backing Marine Le Pen. Well, guess what? It's the very same people that backed Donald Trump.
Yeah.
It's people who feel that they've been abandoned by their government, that they've been abandoned by the society, that they've been made promises that haven't been kept, that they can't get anywhere, that they're in their 50s or 60s and they're drowning in debt and have nowhere to go. That is an explosive political force.
It is, but also there are a lot of the elite backing those folks too, because they want to keep the power structures in place, just to what you were just saying. So the money that was poured into Donald Trump's campaign, sure, there were tons of individuals giving small donations, but a lot of that was coming from huge, the oligarchs of the United States were putting him into power. And it's the same forces that propped up the Tea Party. It's to keep the structures in place and to keep our version of capitalism going, no matter how much damage it does.
Very unregulated version of capitalism.
All right. So we're not going to solve all the politics in the US in this 1.5 hour, but I do want to drag us back to healthcare. So I want to pick up on so two things. One is the one that Rosemarie brought up, which is the and I would like to get to the data brokers if we can quickly. We only got 30 minutes left though. So Rosie, I want to pick up on the topic you raised, which is COVID dead? Is COVID gone? What's going to happen? What's the impact of that? And then try to go to talk about the employer stuff with Jen a bit. And if we can drag in data brokers at the end, let's do that. But anyway, Rosemarie, say a few more words about where you think we are with COVID, and then perhaps we can all weigh in on what we think this looks like, and if we get the second wave of Omicron, well, sure, you're getting on the East Coast, we haven't got to the West Coast yet. What happens what happens?
Right. So people are still getting infected, not at the huge rates here that they were. And if they get infected, if they're vaccinated, you don't get that sick. Although you can keep hearing stories of people who this is a very wily virus, and we don't know yet why some people get more affected or infected than others yet. I just spoke with a colleague of mine who said she had brain fog and couldn't function so she didn't have respiratory issues or anything, but she could, and she's a consultant, and she couldn't use her brain, and she's totally vaccinated, all the things. And it was a pretty alarming story. And her doctor had plenty of those stories of people. And then there's that notion of the long haul. If you have been infected. So the experts are still saying, if you can get vaccinated or you need a booster, which I just got mine, go do it. Do anything you can to try and defeat this wily virus, because the one thing we know is we can't predict it. So as much as we're all craving this reemergence in the spring and stuff, I have to say, I feel very nervous when I head into big places that are not requiring masks. And I don't tend to be a hypochondriac, but the experts are nervous about this too. And I think there's such desperation to have some normalcy, but I don't think we can completely relax. And I think it was interesting that the public health emergency was extended, and the mask rules on traveling and things like that. Anyway.
Just a data point in support of Rosemarie's observation. I just did the math. We are 64th in the world in terms of the rate of boosting at 29%. We were kicking Slovenia's ass, but we're now like 3 percentage points behind. It's pretty bad when you think about it, when they invented all these vaccines.
Yeah, I mean, I'm going to confess that I 4 Pfizers on board. Then I got a breakthrough of Omicron in early January. And because of course I ended up in an NIH clinical trial, that's going on for another year or so. But so I got the Regeneron, whatever their drug is. And then last Thursday, through the same trial bunch, I got Evishield. So I'm like full of everything. But then, I am an old with stage 4 cancer. I check all the boxes. But I do reflect on my ginormous privilege because I have a really good original Medicare setup and I kind of don't have to ask for anything. It just kind of shows up. And thank you, universe. But that's the biggest problem we have right now is the lack, the inequity of access to things. Granted, the COVID vaccines and COVID tests are free, but people still need to go there to do that. And that is not always possible for folks who are at the lower end of the income, or equity or, whatever, thing, particularly the working class folks who have been called essential workers, but who are still not able to take time off to go get vaccinated unless they work in a Kroger or something, and then maybe they could wander over on their break. But at the same time, we're still a nation of vast inequities. And, that's led to the class issue that Jeff brought up. And I think that if pressed, most folks in the United States that are of a sort of middle to lower income thing would fight against the idea that they weren't the same as these other people. And I think they're right. But at the same time, figuring out what the way to address that is, that's where all the arguments are happening. And, we haven't gotten to a consensus yet.
So there's also the long-term harm, not just of COVID itself, but what the governors are talking about is the kids who are out of school, all of the other kind of ripple effects. Of course, we've talked about the mental health that so we're not really, even if the virus somehow we can suppress it finally, get rid of it. I don't know. There's going to be these other so-called like long haul effects that aren't the medical per se. They're that we will be struggling with for quite some time, and public leaders will be trying to address.
Yeah. And BA1 and BA2 have mashed up and made XE. So now we've got a new variant heading our way. It's like, oh, great. Yeah.
Yeah.
Jen?
And those long-term effects are vastly different depending on your socioeconomic situation. So, we've seen how COVID had a very unfair impact on people to begin with, but those long-term effects are going to be the same thing. Whether or not you're at an employer that is going to give you tons of flexibility if you have long COVID and you need to take a day off every week, or you have one where that's going to risk your job. There's just everything is kind of amplified by the socioeconomic scenarios that people are in. And I think that there's still not a good lens that is always a huge factor at play. Even when you talk about the vaccine hesitancy and people not getting vaccines, we're not always talking about the barriers or the trust issues. A lot of the conversation kind of blames that individual. Like, you're not getting the vaccine because you're a dummy. You're not getting the vaccine because of all of these very legitimate barriers that are in the way.
All good points.
Well, before we leave this, just one last question. Maybe Ian, Jeff, you've had some feedback on this one. It all comes down to a couple of things, right? One is there is the cost of the societal cost of two people having COVID, the long-term effects, all the rest of it. But then there's the stuff that we were flattening the curve for in the first place, which, how much pressure is this putting on the current healthcare system? My impression was that, that we ended up with, despite the vaccinations, around Omicron, a lot of pressure on the healthcare system again. It seems to have eased off. How ready in the East Coast, is it coming back? I'm hearing a lot about super spread events in Washington. Is it back, or is it, are we going to be seeing emergency rooms full and ICUs full again? Or
we peaked at a hospital census of about 120,000 during Omicron, and and there was a lot of dispute, frankly, about what percentage of those folks were there because of COVID or were there with COVID, where COVID was a comorbid condition where, there was something else going on and they got tested and by God, they had COVID and were, but, the ICU census was 20 or 25,000. It's dropped dramatically. So a lot of my colleagues in the hospital world are, they're trying to recover and rebuild their places. They're trying to get staffed up. They're trying to fill the holes in their clinical apparatus. They're trying to comfort people and let them know how important they are and try to get moving again. But they've, that first quarter was an economic disaster for the hospital industry. people were just bleeding, and that bleeding was arterial bleeding. It was bad enough that it's going to affect the full year financial performance for a lot of these big places.
Yeah.
So there's
And
a
the small
lingering
places.
effect.
Right.
There's a lingering effect there, and of course, I believe Rosemarie may have a different opinion. A major factor in the extension of the public health emergency was the real prospect of, at a minimum, 5 or 10 million people losing insurance coverage, and the payer mix in these institutions that got clobbered in the first quarter just dissolves. So there was a huge risk. I mean, it's something I've been talking about in my talks, is that, even without that, the prospect of a recession and the idea that we may not have the same financial resources or the same willingness on the part of many state governments to fill in those gaps is a very real lingering risk.
And I think we alluded to the burnout factor. So having that Omicron wave over the holidays was so demoralizing. I'm on the board of a safety net hospital. It was just heartbreaking. And it's like all the tricks of like, oh, let's do pizza lunches and all this. It's just like, been there, done that. It's not enough now. It's too entrenched now, that burnout factor.
Yeah, I mean,
and that's going to be hard to recover from.
During that winter surge, my mother-in-law, Karen's mom, who's a care manager at our local university teaching hospital, walked in the door on Monday morning and was given a caseload of 50 patients to plan their discharge. 50. And there was no backup. 2/3 of the positions in her department were vacant. And that was, January, February. I mean, 68 years old. I mean, that's going on all over the health system.
Right. Yeah, I agree with all of those observations, that the first quarter finances were badly hit. A lot of it was to do not only with the surge in patient load, but just the fact that people on staff were testing positive and were unavailable.
Right.
I mean, I remember, probably said it in previous gangs. I mean, it was our friend who ran Valley Children's. He, at the height of the surge in late January, he had 1/3 of his OR staff test positive, and he only had one environmental services worker for a 1 million square foot building to clean the building, who wasn't, so that's what really slammed everybody, the combination of all of those things that Jeff and Rosemarie talked about. And, it's going to be a rough year on the finances as a result. But Matthew's right that the absolute demand, it may have been as high as 150,000 cases, but we're way down, with all the measurement issues Jeff alluded to.
My concern is that we were that if you look at the wave that was in the end of 2020 with no vaccinations, and the wave that was Omicron, in terms of cases, I know there were fewer deaths, but there was a decent number of deaths. We're about to get to 1 million official deaths sometime in the next, few weeks.
I think we're actually past it, but our
we're actually in reality well past it. And at some point I'll get Emily Evans on, and she has a whole theory about where the missing deaths, the moving disease. There's a whole bunch of interesting data stuff at play. But the question, at that point, we were pretty well vaccinated as we were going to be by Omicron wave, November, December, January. Now we're at the stage where we're talking about the fourth booster. As Ian pointed out, that those numbers are falling. I'm 5 months out. I haven't got my fourth booster yet. I'm going to try and wait for 2 more weeks and, try and play the odds, because how long should you be waiting? And there's not that great information about what it should be. And I'm worried that if, we get another variant that's as bad, people are kind of done with masks. They're done with, everyone seems to be done with the idea of public health. Those of us who've been to Miami or Florida know that no one cares. And yet you still have people who are immune compromised folks. You still have kids who haven't been vaccinated below the age of 5. You still have, there's a lot of stuff to go around, and the vaccination rates effectively are falling because the thing doesn't work after 6 months, and maybe doesn't work for new variants. So I'll close this chapter saying that I think we have to keep our eyes open. This is still pretty scary, and we're now 2 years plus into this thing. And
I just looked at the New York Times numbers. 993 deaths from COVID yesterday.
Yeah, it's 100,000 a day. We'll be there. We'll be at 1 million in 2 to 3 weeks. All right. Quickly, Rosemarie, and then we're going to switch to the important topic.
The other category, of course, is folks who deferred care because they had so-called elective surgeries they needed, or they didn't go in for their cancer screenings. And
Right.
that's what the healthcare providers I know are just sort of, I was going to say they're sick about it. I don't mean to be funny, but they're just upset because they had been so on top of all that stuff. And now it's backslid, and it's going to be really hard to catch up.
Yep.
Yeah. Right. Okay, let's quickly go to the topic that Jen raised and Ian wanted to chat about, which is what are employers up to, and what just so Jen, what do you know now you didn't know 2 weeks ago about the temperature of employers and whether they're about to light a match to the whole thing and burn it all down, or whether
Well, I don't think they're going to burn it all down, but there are some interesting topics that seem to be getting the lion's share of attention right now. One, the one that Rosemarie just said around deferred care is a huge concern for a lot of the employers that I've talked to and a lot of our clients, which is that they know that people haven't been getting the preventive screenings that they should have been in the last 2 years. And so what's going to happen when those cancers are discovered at a later stage, or any sort of disease or condition is discovered at a much later stage, and what kind of impact is that going to have on costs and outcomes and so forth? So that was definitely a big topic. Mental health, of course, which we've talked a ton about this, and somewhat jokingly, but I think that this is kind of a real sentiment. Several of our clients have said that their C-suite has just told them, fix mental health care, like this quarter, just fix it. And of course, that's not something that can be fixed in a quarter. But there's a lot going on there, lots of new companies, lots of attention, and lots of effort, including by those executives to try to get some of the stigma out and so forth. Lots about provider quality and how are we making sure that people are getting to the right providers. And then we've touched on it before, but the intersection of benefits and diversity, equity, and inclusion initiatives, and how are employers addressing racial disparities and taking care of all of the niche segments of their population and so forth, and how do they get all of their benefits and rewards initiatives in sync with the commitments that their companies are making. And there's a lot of energy around that topic right now, and a lot of work going into figuring out what are the right actions to take. So those are the big themes, all really interesting. And Rosemarie, I'm sure you're hearing all sorts of similar things in the work you're doing.
Yep. Mental health is top of mind, and I think in a really good way, where a lot of CEOs are even admitting, and senior C-suite folks admitting vulnerability in that regard, which was sort of never allowed before. Yeah.
I mean, and you're still seeing, I mean, the amazing thing is just looking at the stuff that Jess and I look at in our health tech deals and for new funding, there are still just unbelievable amounts of new mental health. There's huge money in the mental health companies, unbelievable amounts of money coming for new mental health. There's clearly still a massive supply constraint. I mean, we talk about where there are enough people, if I could just quickly try and go back and train as a psychotherapist, I could make some money. But you and by the way, as Ian mentioned, the Great Resignation, a lot of people who are, this goes for nurses who on the wards having a tough time, can now sit and be coaches, nurse coaches in some of these new tech companies. Same thing is true with actual therapists and coaches and psychiatrists who are shifting that world. But that's the one world where telehealth really has taken off. I guess that the other question, I mean, Jen, I'm always, and I think Ian has this with PBGH, his relationship with PGBH. My
PBGH.
PBGH, thank you. And it's no longer Pacific, right? The Purchase Business Group on Health.
Purchase Business Group.
The question of, is there enough appetite? You hear, I mean, so this stuff, everything you mentioned is good stuff. It's new programs for HR. It's, new things. Let's fix mental health. Let's do this. I don't hear the squeal. I mean, maybe it's because corporate profits are good and inflation's going across the board. Even though inflation is hitting the healthcare sector, I'm not hearing the squealing about costs that we used to hear several years ago. And I have, at least from one or two of the startups I talk with, heard that we're good because we have a program that, you know, whether it be for weight loss or mental health, whatever, that takes a year. So if somebody gets into our program, they stay with that company for a year and the company loves it, despite the fact the program costs a lot of money. Do you think we're going to hear anything about, you know, costs and radical revisions to how we buy care for our self-insured populations until we're past this employment crisis due to, as we mentioned, lack of employees?
I think at this precise moment, it's not a top issue for a lot of companies because, as you said, they just need employees. And why did healthcare become an employee benefit to start with? Tight labor market and attracting people. That's why we're in this kind of accidental setup to begin with. So I don't think it's the number one issue right now, but it's got to still be there and something that is addressed in the next few years because the costs keep going up and up and up. And there's only so much cost shifting you can do to employees. And way too many people are in high deductible health plans. We know that people defer care because of that. There's actually quite a bit of startup activity of helping people finance their healthcare and, you know, better budget for healthcare and things like that, which is great. But the core issue there is that healthcare is too expensive, even if you have good insurance. So that's going to all come to a head at some point. I just don't know I just don't think it's going to be this year.
Well, I mean, this is why the issue about the Fed tightening is so important. And that is because the Fed does not have a history of engineering soft landings. And a hard landing damages corporate cash flow. And the moment that happens, people begin looking at, you know, oh my God, I mean, my health costs have not been our main cost concern, but they're a huge percentage of our employee cost. Yeah. And, you know, and our stock is going down and we need to do something. So there's, you know, typically a year to 18 months lag between the onset of a recession and major changes in employee benefits. And of course, I'm with you, Jennifer. I think we've grossly overshifted economic risk to employees. I mean, you know, it isn't health insurance anymore; it's bankruptcy insurance. It isn't covering health care anymore. You know, and you know, $6,000, $7,000, $10,000 deductibles. How many of the people have the $6,000, $7,000, $10,000 to pay the cost? Very few. Yeah. So I think there's a collision out there, and I think the other collision is when health costs, when our friends in the hospital world begin trying to pass through the costs of all of the wage increases that they've had to put in, and all the overtime, and all the rest of that stuff. United Health Group and Anthem are going to say no. There's going to be a collision.
And meanwhile, the payers are, you know, they're throwing glitter every 5 seconds over their, you know, dividends, shareholder value, you know, revenue, et cetera. So, you know, they're talking out of both sides of their mouths like a profession, because, you know, on the one hand, they're standing on providers. And, you know, Matthew noticed that I shared something by Wendell Potter early, you know, it was last week, where he took a deep dive into somebody's balance sheet. I can't remember. Actually, I think it was a few companies. And I mean, Matthew's response was, well, what about providers? And waiting for that too. But I actually think that providers in a lot of ways are much less at fault here. They're just trying to keep up, keeping the lights on with, you know, the way that the payers, led by CMS and the Rock, and, you know, I mean, I could derail this conversation easily, but let's not. But, you know, there's so many other pressures outside of the providers. I mean, sure, there are large systems that are playing all kinds of games, but that's because the game is rigged for them to be able to do that. And trying to get past that, it's, you know, this very herky-jerky employer-sponsored insurance for some, and then for others, commercial payer. And then if you're lucky enough to live long enough, you get a decent Medicare thing, unless the Republicans take it away, which they do, they could have it next week. So it's just, we're a hot mess. We're just a hot mess on blast.
All right, two quick things to recommend. One is that Wendell Potter piece. Wendell has in times got a little emotional, got his, like George Helgson, he's let his emotions get ahead of his data sometimes, but this one was very rational. Just basically looked at the concentration and growth of the Bukas, you know, the big for-profit plans,
Big
from the
ones.
Hamptons, right? And their share and their rate, their relative stature within the Fortune 500. And, you know, you go back a decade and a half or three, when we all thought that the Obamacare was going to cut Medicare Advantage and, you know, make them compete on price, not so much. So that's one. The other one is this great, really good exchange. I don't know if it's recorded, but the Duke Margolis folks had Liz Fowler, I'm blanking on his name, but the person who's now heading up Families USA, and the guy at Morgan Health. I'm blanking on his name as well.
Dan Mendelsohn.
Thank you. They had a great session yesterday, the day before, which was basically, and the Families USA teed off a lot of this stuff, and you know, and I thought it was actually really interesting how much agreement he got, even though Liz was unable to say how she was going to fix it from within the Innovation Center. But we're thinking, okay, quickly we're going to go to Ian, and then we're going to try and at least mention the data broker thing, and then we're going to wrap up. So, Ian.
Well, just to tie a thread back to what Rosemarie started out at the very beginning, because compounding the effects we just talked about is the vulnerability of the coverage that took place as a result of the pandemic, you know, and I mean, Medicaid went up by 20%, according to CMS data that came out in the last week or two. And if those things get unraveled at the same time as Jeff's slowdown happens and Jen's right in the short run, I think strategically the employers want to push back on trend and on cost, but they've got bigger fish to fry in the short run in terms of just keeping their bloody workers in this great turmoil. But you put all that mishmash together and you could end up 12 months from now in a very bad place for the delivery system, where you've got pressure from employers, you've got no political will to maintain the coverage that was put in, and payer mix impairment and the uninsured going up again, and a slowdown in a hot jobs market where, you know, unless you're lucky like those of us who are made it to over the Medicare line, that anxiety starts to build again. So, you know, stay tuned, I guess, as Casey likes to say.
All my years in television. Sorry.
Yeah.
Okay. Real quick, Casey, before we wrap, I just want to go to you briefly on the data brokers thing.
I'll keep it very short. John Oliver did a brilliant job explaining why data brokers are creeping. I have been talking about this for years. I would like to propose that rather than defenestrate the entire web and all of the things that happen on the web and the fact that ad tech is so deeply buried into everything we do, how about we come up with an idea about, if you're selling your users' data, there's going to be a special assessment tax on you for that, because you know, depending on how much you're making, and we're going to put all that money in a pot and we're going to turn it into the beginnings of a universal basic income program. How about we give that a shot?
All right.
We're here. Brilliant policy proposals all over THCB, gang.
I like it.
All right, fantastic. All right, with that, we're going to wrap for the week, and I want to know what people are thinking about for the next couple of weeks. I will advertise that now. I've got all organized and I've arranged some future gangs coming up on May the 5th. Is going to be one which is going to involve some of the people in this program, with Adam Pellegrini from Jasper Health, which is one of the new cancer navigators, and in fact, four of the 5 of you are going to be on this. We had a session a while back with some of us on the show where we got into this issue of what dealing with cancer was like for about 5 minutes at the end. And I thought, there's a seed of a great program here. We should do more. So we're going to do that one. I would think that, you know, given what the Light Collective has been doing, Casey, and where, you know, what the origins of Andrea Downing and some of the others involved in that have been, data production around cancer and data brokering around cancer is going to come up in that point. Anyway, we'll that's a commercial. We will go around the room now and see what people are thinking about for the next couple of weeks. So I will start with you, Jeff.
I'm just on tenterhooks about the possibility that we're just one madman's thumb away from a war between NATO and Russia.
I'm sticking my fingers in my ears and going, because I don't know what the hell we do about it.
It's just right on the tip of his thumb. He just pushes the wrong button and we're at war. That's the
Yeah.
one that's worrying me and has nothing to do with healthcare.
Well, I mean, I remember a while ago you mentioned something about Taiwan, and I mentioned something about Russia, or the other way around. You know, a long time I said, well, that will help drive any domestic agenda away. And, you know, clearly it's driven the domestic agenda off the front pages and, you know, really focused the Biden administration. And they've done a great job so far. But yeah, I mean, I don't how you negotiate. I mean, it's the thing about Hitler. How do you negotiate with the guy with an atomic weapon? Anyway, not a fun topic to think about, so I'm just going to ignore it. Jen.
I don't know. There's just so much that's so heavy going on in the world right now. And, you know, so my thinking is just along the lines of what are the places to get involved and to, you know, push for things that we believe in, and not completely tap out and tune out, but somehow stay engaged in the things without completely sacrificing your own mental health. There's a tough balance there. But that's kind of what I've been thinking on, and just all of the things, everything that we talked about on this call and everything in the headlines that needs to be fixed. What are the right places to play an active role?
All right, good thoughts. Rosemarie, you don't have to be too philosophical if you don't want to be.
That was beautifully put, Jen. I'm right there with you. I found one little glimmer, and you know, you said headlines, Matthew. Sometimes we have to remember there's a lot of good things happening that aren't going to be in the headlines because maybe they're kind of boring, but they're real. And it caught my attention that getting more broadband access is actually a way to get more healthcare access. So tying back to, you know, the mental health things, and so there's still lots of rural areas that don't have the broadband and therefore can't do the things. And I hadn't really thought about that tie-in, and the Biden administration is deploying folks to get some of that infrastructure money really in place. Yes, before the midterm elections, but those are good things that have potential.
And there's a big economic impact there too, in terms of the remote jobs that become available. My sister lives in an area that's going to get that access. It's going to be amazing.
Yes. Casey.
Wait.
Well, I'm going to, you know, there's a hometown hero here in Richmond, my adopted city. His name was Arthur Ashe. And one of his aphorisms that I live by is start where you are, use what you have, do what you can. I get up every day, and that's kind of what I say to myself. Granted, I got a 360. I grew up in the military industrial complex, 4-generation military officer family. And I'm very well aware of everything that's going on globally, but what can I do today to help other people and help move the game pieces forward? That's, you know, I get up every day and just do whatever is on that list, and then I keep going.
Ian.
Well, I'm going to be off for about 6 weeks, 3 weeks working and 3 weeks traveling with the grandkids. So I'll miss you guys until I get back. But I think a big question we've got to start thinking about, given stuff I've been reading on kind of evaluating the value-based care movement, like Sachin Jain's piece this week, and Mike McWilliams, is it, his review of Medicare Advantage. If that's not the answer, what's the plan? You know, and Jeff and I have been talking about this offline about what is the plan going forward. That's a bigger discussion, and the seeds of it may be in that Sachin Jain piece about the rediscovery of professionalism as a kind of anchoring in the industry. And so maybe that's a topic we can bring to the fore in our conversations going forward.
Yeah, I was reminded in that Sachin Jain piece, he pointed out that he was Elizabeth Teisberg's research assistant. I remember when I wrote my review of the Paula Teisberg book, I said, this is the best, you know, the Harvard professor's got the best research assistants, because the first chapter was an amazing, you know, tour de force history of the US healthcare system, whatever went wrong with it. And the rest of the book I thought was dreadful, but and I got in trouble for saying that. I said it was the worst part of Allen and Hoban without the series stolen, but that's by the by. But anyway, my main concern for the next couple of weeks is, you know, obviously who's going to buy my two favorite institutions. So who's going to end up with Chelsea Football Club, and what the hell is Elon Musk doing with Twitter? Worries the crap out of me.
And there's your ultimate worry is Elon Musk buys Chelsea.
Actually, that wouldn't be a bad idea if he's better put enough cash into it. Somebody actually richer
And
than
he leaves Twitter alone.
He can buy Chelsea as long as he's prepared to put some cash. I think Elon Musk is uninterested in sports other than trolling people on Twitter. So we'll see.
Okay.
But we'll see what happens. All right, and with that, we are done for the week. I want to thank my guests. Of course, we had Rosemarie from Massachusetts, Jen Benz from the City Center of San Francisco, Casey Quinlan from the capital of Confederacy in Richmond, Virginia, Ian Morrison from the wilds of Menlo Park, California, and Jeff Goldsmith from Charlottesville, Virginia. This is Matthew Holt saying thanks for watching and listening to THCB Gang. It was the April the 14th edition. We will see you all next week and look forward to hope everyone has great travels, especially those of you, Ian, going to Scotland and drinking whiskey. Have one for the rest of us, all right?
Yep, absolutely.
All right. Bye.